I'm the last speaker for this panel this morning. My name is Zom Zolo. I'm an advanced midwife. I'm speaking on behalf of the Society of Midwives. I'm speaking on behalf of the Society of Midwives of South Africa and for the midwives at large that are here from all over the world. But can we see how many midwives do we have? If you can just stand and then sit down. And if you can just stand for the people to see. Thank you. Thank you. What struck me about this conference is that finally, the newborn has found a voice amongst all the excellencies. However, as you have seen the little group of midwives that are here, it says to me, we needed more of them in this room today. However, we have the opportunity to have been here. Now we have the responsibility. I'm sitting here with all this enriching experience and say, I want to run the 1,000 days. It's so small and it's so short. What is my key message? What is our key message as midwives? There will be no improvements in newborn care without midwives. Midwives ought to be there in every agenda that will address newborns. Midwives, we've all agreed, are the frontline skilled birth attendants. Midwives are the backbone of the health system. Midwives are the first choice of the woman in the whole continuum of care. They start with them, they end with them. We need more of them. The whole world need more of them. ICM, UNFPA, the World Health Organization combined to make that statement, we need more midwives than ever. Midwives are the champions for sustainability within the multidisciplinary team. Midwives are with women and baby. And the obstetrician I had, the obstetrician is standby. That standby, we need him in that multidisciplinary team. What then is our way forward as midwife? As midwives associations, we want to strengthen our leadership position in making sure that we make our midwives assume or strengthen their role in advocacy for patients and also as change agents, and of course in the area of accountability. We want also to tackle the area that has been coming through of attitudes and as well as looking at the burden of work and say what is going to happen there. But also we want to lobby for more champions from our governments, that we need more of them. But once we need more of them, we need also an environment that is conducive to retain them. If you want to save newborns, as you said, you're going to save newborns, you've got to save mothers, but also save midwives in order to save newborns and save mothers. Midwives want to capacitate all those that are also helping in enhancing, in helping them in this skilled profession, in this art of midwifery. And also, we want to collaborate with all our sister organizations and making sure that we've got the right kind of midwives who are trained appropriately, allocated appropriately, and retained in those positions to give the appropriate care for newborns. We've got our Neonatal Nurses Association with us. And also, we want to fast track that area of direct midwifery entry, especially in our communities. I must say that in South Africa, we already have a policy that says no rotation of staff, so that continuity of care must proceed. Lastly, let me just say, we rely on you as our partners, as our supporters, and as our funders. We cannot do this alone. In this room, as all of you are sitting here and many others, please support the initiative by the midwives in capacity building in their workshops and conferences and congresses. Also in the research agenda that will bring evidence-based practice, and also in the implementation of the priority programs which all of them are in the hands of the midwives, and they must stretch, I don't know how far. We want to roll out to the essential newborn care, the HPP, and also we want to make sure that we must balance this up, that karma is also our key strategy that we're gonna run with as midwife, accelerating the reduction of maternal mortality and so on. We need resources to do that. And maybe let me say finally, as midwife we say, forward ever, backward never. And maybe it is time that we can all stand and sing that song and say, until I reach my goal. Will you help us? Until I reach my goal, until I reach my goal, I'll never depart from the golden rule until I reach my goal, until I reach my goal, until I reach my goal. Never depart from the golden rule until he says, well done. He says, well done. He says, well done. Never depart from the golden rule until he shakes my head. He shakes my hand. He shakes my hand. Never depart from the golden rule until I reach my goal. I reach my goal. I reach my goal. Never depart from the golden rule until I reach my goal.